Now I'll show you a few exercises you can do on a ball. We're using a 65-centimeter ball for Leanne because it places her hip and knee at about a 90-degree angle and allows her spine to fall in neutral alignment. Sitting on the ball alone is going to challenge her core. We can increase the challenge by changing her center of gravity. If she were to place her arms out to the side, lifting one arm to the ceiling and back down, other arm can reach and back down. We can move that center of gravity more forward by reaching one arm forward and going back. And her body muscles are having to strengthen, to contract to keep her balanced on the ball. Release the arms down to the side. We can also do some work with the legs, and this is rather challenging, doing a little bit of a heel slide, trying to stay balanced. She has to unweight that leg, slide the heel forward and pull it back. She can repeat it on the other side. Let's try it again with a little breath control. Exhale, inhale, exhale, back. Now be careful. She's cheating a little bit by leaning back, so she's going to try to keep that rib cage right over the pelvis. Back to the left leg as she leans, reaches forward, pulls back, pause, inhale, exhale, slide forward, and comes back. You can see that there's a little more weakness in that right side, so it's making it a little more difficult for her to slide that heel. Another activity we can do that brings sort of the child in us out is just bouncing on that ball. It really works the glutes and quadriceps all the way down into the feet and calves. And it's an aerobic exercise. It can get you pretty tired out as longer you do it. And so we'd like to breathe to make it aerobic as opposed to anaerobic. Okay. Then we can get into more advanced type work. I'm going to just let her use the poles a little bit. And when it's sort of the transition between sit to stand, but I'm going to have her pause very low in the range of motion and use the poles to help her sustain that lift a little bit and lower back down. Inhale, exhale, lift, and lower. So try to use a little less arm, activate a little more leg. Inhale, exhale, shoulder blades go down, push through those thighs, and sink back down. Let's think of our core, our inner thigh, and our pelvic floor. So take a breath in, squeeze that inner thigh a little bit, push into the legs, pause up, slow return. Good. Leanne's hobby is horseback riding, so this exercise will help her. She's had a couple spills, lacking the strength to hold herself onto that horse. This will help her get that activation of the inner thighs and the core to keep her balanced on top of the horse. So let's try a couple more repetitions. Exhale, squeeze the ball, and slow return. One more time. Inhale, shoulder blades, abs, thighs, and back down. So let's see if we try it without the poles, how that looks.
Okay, what should I do with my arms?
You can have them on your thighs. Inhale, exhale, slight forward lean, lift, and lower back down. That looks even nicer because you're less apt to pull those shoulder blades up that way. Inhale, exhale, shoulder blades down, navel to spine, transfer weight to the feet, back to the buttocks. One more time. Inhale, exhale, hip hinge, push through the legs, and lower with the legs. You hear of lifting with your legs. That's what a sit to stand is. Really, you're lifting your body weight off your bottom and onto your feet. Okay, we're good.